How are you?
Hey.
Echo 931.
All right. Well, yeah, we're recording now, so we can go ahead and get started. Thanks, everybody, for joining us today. We're going to talk a little bit about a couple different things, but more importantly, we want you guys to bring any questions or anything that we can help you with right now to this call. I think our focus was going to be around a little bit around health and good decisions, as well as how that impacts the family and keeping the family safe. And I think part of keeping the family safe is also keeping everybody sane and having, you know, good things to do together as families while you are all cooped up together and making the most of it. And so I just want to point out before we even jump into Jamie and talking about the health part is if you go to fambundance.com/coronavirus, we're just right now giving away all of our intellectual property, everything that Fambundance has created that is wrapped up in some type of worksheet or is in a format that we can bring to you guys and give to you guys so that now you can actually dive into those. Because, you know, when do we have time to really sit and meet as a family for 90 minutes or a couple sessions of 90 minutes to work on our family values, for instance, or structure what we want our family meetings to look like, or our pillar goals, for instance. So all of those worksheets are now live on our website and on the link fambundance.com/coronavirus. And, you know, feel free to share those with anybody, you guys. Now's the time when we need to be giving and bring the things we can bring, especially those that don't cost us anything to really give away. Obviously, we've invested a lot of time and energy in creating that, but to put that website up, thanks to Matt Duncan, is very easy for us. And he also included a conflict resolution piece there as well. So, but Jamie's with us here. She's really literally on the front line. She's an emergency room doctor. She helps coordinate and is a leader amongst her peers, does training, and she's also an entrepreneur and wrote a book that is all about healthy habits. And I think it's called Habit This, Habit That. Is that right? Okay, good. I got it right. Habit This is the different tense version of it. But yeah, it's a great book around healthy habits, and she's a health expert. So we have her on today, and we're just going to let you guys kind of ask questions, and I'll kick it off with a question too, and then we'll open it up to everybody else to just say whatever they want. And you can post questions in the chat box as well if you've got them. But Jamie, I'll just start off with, you know, what's it like right now, and what do we need to know to you know, as far as, you know, our family's health right now and keeping ourselves safe and making good decisions? What would you say are a couple of key things to be focused on right now?
So what's it like? Ooh, it's interesting out there. It's ramping up pretty quickly. The number one thing, if I could encourage everybody, is, yeah, I'm sure you've all heard flatten the curve. If everyone gets this at once, we don't have enough resources. But if we can slow it down even by a month, we can save so many lives. So it's about staying home as much as possible. I know there's still pictures of people posting themselves at the bar like, I'm fine, I'm young and healthy, I'm not going to get it, or if I get it, I'll be fine, which is likely true, but it's increasing the spread of it. So definitely we could use some help with that, because it's ramping up exponentially every day. My group has decided, there's I think about 57 of us docs in our group, and universally all raised our hands and said, we've got some older folks in our group, a few people who've had cancer not that long ago or have elderly parents at home, and we've excused them from seeing all these patients. So we're charging in. But there's also a lot of beauty going on right now. There's a lot of fear, but there are so many ways that people are helping each other. And one of our family mottos, and I know Mike and Lindsay know this, is our family motto is find the good. Whenever we're in any type of difficult situation, that's the first thing we try and remind ourselves, find the good. when we were in Aspen for the Fambundance trip and we got on the gondola, my daughter was a little bit nervous about it. And then once it's going, you can't really get off of it. So just held her hand and said, had her look around and say, find the good. And she's like, hey, beautiful mountains, beautiful sky. And was able to help remember that there's some good in the bad. So the most other important things that you guys can do is to stay as healthy as possible. That'll help keep you from getting it. And if you do get it, it will make sure you've got the fortitude and strength and health to power through.
That's awesome. Jamie, and thank you so much for just being willing to not only share with us right now, but being willing to, put yourself at risk. You were sharing with me earlier that, just the way you even have to treat these patients, it infects everyone who works on them. So you're having to change protocols, you're having to go train those protocols. So I just wanted to take a second and thank you for all of your effort and, being somebody who is always there, especially in a crisis. So thanks for being there for us today too.
Absolutely. The timing worked out good. This is like one of the few breaks in my day from all the COVID meetings. so I can be with y'all, but I'm really happy to be here, help you guys with those healthy habits and anything I can do to help alleviate some of your fears surrounding this.
Cool. Well, let's open it up to questions just so we can start a dialogue here, guys. What are you curious about from Jamie as it relates to health, or even just in general for our families, best practices or things to be doing right now during this time? So.
Zach whispering.
Okay, I guess I'll start it off.
Hey.
Hey, how's it going? So how is it spread? Is it through touch? Is it through air? Is it everything? Is it?
So this is a droplet illness. So it's bigger droplets. So it's not quite the full airborne where you can get it from really far away. Those droplets are spread so you can get them on your hands. And I think this epidemic has taught us one thing, that we all touch our face a hell of a lot. I don't think people realized how much they did. So you can breathe it in, or you get the droplets, you touch a surface that's still contaminated or somebody else. And then inevitably, we touch our mouth, people are picking their nose. It's the truth and all that kind of stuff. And then that's how we get it. I think the epidemic of nose picking is finally over.
How long does it stay alive on surfaces?
So it depends on the surface. If you're talking about, it's surprisingly a very weak virus living outside. So sunlight, extreme temperatures, and things like that, it can't survive in that. It's meant to survive in us, and it doesn't last long in the air. On surfaces that you can touch, sink handles, doorknobs, light switches, things like that, assume for now that it can last hours, and we're doing constant testing, swabbing surfaces to see how long it can last. If it's a little bit of a dirtier doorknob that hasn't been cleaned in a while, so there's already some things growing there, it can kind of help, so really everything that you can touch can potentially be contaminated.
So washing your hands, how long with soap do you have to wash your hands?
So minimum of 20 seconds with good rubbing, and then you also have to dry them very thoroughly. So I have my kids sing Happy Birthday or a song like that while they're washing their hands to remind them to wash long enough, because usually kids get bored in about 2 seconds of washing and try and find something better to do. And hand sanitizer is, yeah, you're like, I'm done in 5. And hand sanitizer is effective. There are some germs that it's not effective on, but it does work for this.
And that works on kids of all sizes and ages, the birthday kit?
Yes, I can write down the words for you, Mike.
I got that one down.
So the hand sanitizer, do you do it 20 seconds or happy birthday?
With that, it's a little bit different because it's the drying that actually dries out and kills the virus. So you just keep rubbing your hands until it's dry. Hold on, my son has a question. Oh,
Mama?
Yeah.
Can I hang up the decorations back there?
Yes, you may.
Hey, Christopher.
Hey, Christopher, Mr. Mike and Miss Lindsay say hi. Okay.
I appreciate it.
So Jamie, what are some of the other ways that we can stay healthy right now when we're all cooped up and you know we're inside all the time? What are some things we can be doing as a family to stay healthy, to stay active? Like, or what are some of the things you're actually doing with your family to stay active and healthy?
So, well, the good news is you can go outside and play. So you don't have to be literally in the house because we're all going to kill each other if that happens. So it's still safe to go outside and play. So we've kind of created a homeschooling situation. So, you know, we get up, we get dressed, we have math, they're eating lunch right now, and then we're about to have outdoor recess. So I'll be taking this phone outside with us. And we're making up games. We have tons of board games. You guys know that. I sent you a bunch. Those are fun. Yeah. And giving each other choices. So in times of uncertainty in particular, we can feel a little bit powerless. We can't control everything, but we can control how carefully we wash our hands, how we're not around others, what surfaces we touch. And we can also control lots of different stuff. So today, okay, guys, which green vegetable do you want to choose for your lunch? Reagan chose broccoli, Christopher chose green beans. There's so many little choices and little ways we can do it. Broccoli and pepper. Okay, thank you for the correction. I appreciate that with salt and pepper. And then coming up with different games and ways that we can trade off ideas. So it's, you know, Reagan is going to be our art teacher today, and she's going to come up with a fun activity for us. And we are alternating things and taking a lot of silly breaks. When stress is going on, one of the best ways we can combat that is to remember to also, you know, as we find the good, be silly. So we've been turning on Alexa a lot and doing some dance parties.
Dance party! Alexa!
You can,
dance party!
no, you guys, don't start it while I'm on the phone.
I pronounced that dance party, but I'm always working on how I say things, and I might not have it right.
Maybe we should also stop.
I just unplugged Alexa.
Has there been any studies with people that have actually had it that are years old, alive 2-3 weeks with it, or?
Sorry, that was cutting out. I didn't catch that.
Say it again. We couldn't hear you.
Can you hear me now?
Yep.
Have there been any people that have had it that are 30 years old and have had it for a month or 2 months or however long and are great?
That are great or are not great?
That are great.
Like,
They're
still.
Are
fine.
people recovering from it, Jamie, is what he's asking?
Yeah.
Oh yeah, absolutely. So the mortality rate of this is 2 to 4%. So that means the vast majority of people are going to survive this. And it can cause lung damage, but so far we're not seeing anything that's been permanent and long lasting. So it's more of a fluid in the lungs and not actually damaging and turning the lung tissue into more fibrosis type of thing. So as people recover, they will recover.
So we have a question.
So why is
Oh, go ahead. We have a.
So why is this such a crazy thing if this isn't? I mean, yeah, I get it, it's killing people, but like you see these memes that say, you know, cancer kills more people, drunk driving. So why is this so crazy? Why is this such a big deal then?
So that's a really important question. So what it's doing even to young, healthy people is it's causing that when you get that fluid in the lungs, so you can't breathe, and it's causing us to have people hospitalized in the ICU. That's not just the old people, but the young, healthy people. We actually have 2 ER doctors in the ICU right now. It fills your lungs with fluid and you feel like you're drowning and you can't breathe. And we don't have enough ventilators to save everybody if everybody gets sick at once. We don't have enough masks to protect the staff who are taking care of us, which means we start losing doctors and nurses off the front lines. So it can make young, healthy people very sick. It's just not killing us. And with cancer and heart disease, like true heart disease is the #1 killer of people in this country. So I wish people would also be a little more like excited about that, just eating healthier in general. But this, it's how rapid it is and how severe the effects can be even on young, healthy people. And older people, smokers, people who have COPD, uncontrolled or poorly controlled diabetes and high blood pressure are dying from this.
Got it.
Got it. Hey, so there's a question here. I'll read it for you, Jamie, from Lucas Piper. He said, because testing is not readily available, do you think healthy adults who are feeling the symptoms of a cold should just quarantine, or do you think they should definitely try and get tested if they have the related symptoms? So like stay home and wait, or go and try to get tested? It's a really good question.
That's evolving rapidly right now. First of all, I mean, self-quarantine for sure. So our hospital has really been, I'm extremely proud of our leadership. We've really been leading the way in this. What's that, honey? Yeah, you can go ahead and get your, go change and get your shoes and socks on. Parent life, right? Yes. So we've immediately ramped up something called curbside testing. So you drive up in your car, somebody who is in full protective gear will come up to your car, ask you about the symptoms, swab you, and then tell you to go home and self-quarantine if you're not sick enough to need to be hospitalized. And then we call you and tell you the result. The benefit of that is it helps us know the true numbers of how many people have this, and it helps us follow the flow sheet of the spread so we can track it. But if it means going into an ER to get tested, or a doctor's office with a waiting room with a bunch of other people, don't do it, stay home. So if you've got curbside testing, by all means do it, but otherwise going into a place like that just means that the few people who don't have it are gonna get it.
Is there an easy way to find out if where their curbside testing is available, or do you just call the hospitals in your local area, or how would you go about that?
Yeah, check their websites first. Most hospitals are being extremely proactive about updating their stuff regularly. So it's already on our hospital's website. We are getting lots and lots of phone calls, so we'll try and limit that. And then if you're in your area, so if you check on your hospital in Austin, for example, and see, hey, they're doing curbside testing, just let your Austin friends know.
Cool. All right.
And if any of y'all are in Detroit, that's where I'm at.
Cool. Let's see if there's any other questions live here, you guys. We've got Jamie. She's well versed in everything medical. So if you have any questions related to this or even otherwise, I'm sure she could help out right now.
Yeah. Also, the flu is still going on. I tested 20 positive people on my last shift, and the flu's not great either. So
some people are getting the regular old flu and then testing, and it's not coronavirus.
Correct. The incidence of co-infection we're finding is extremely low. So if people are testing positive for the flu, it's very unlikely that they also have corona. But we're also sending them home and having them quarantine because we don't want to spread the flu also.
Got it.
And here in DC, we also have allergy season coming on too. So there's overlapping symptoms there. It's terrible.
Yeah, same in Austin.
Yeah, it's finally starting to warm up a little bit here in Detroit. So same thing. And every time anyone gets a sniffle, sorry, I'm letting my dogs out.
Yeah.
Anytime anyone gets a sniffle, they're going to be afraid. Are you going to come outside, Jojo? Okay.
Mike, there's something I'd add real quick. With regards to like, especially front lines being in the pharmacy, and as a pharmacist, I'm seeing people try to make a run on the pharmacies now. And that's a whole nother point, that it's like, we've got way too many people coming in, and CVS or Walgreens or, Walmart, to my knowledge, hasn't just shut down to drive-throughs yet, at least in the South. But that could be a possibility very soon, just to limit the number of people coming in contact with other people. But that's been a real big issue, and patients trying to say, they picked up medications 4 or 5 days ago and they want another 90-day supply. And it's like, we're going to go into a national drug shortage if that happens. So just kind of reiterate to your friends, family, that kind of stuff. Supply chain is not affected as of right now. I've been keeping a really close eye on it. That doesn't mean it couldn't become a problem, but it's not right now. So we want to deal with one issue at a time, if at all possible.
Yeah, I think it's important. Like, look what happened with the toilet paper. I mean, that escalated really quickly. And this is not a GI bug, it's a respiratory bug, but it's just kind of that panic type thing. So we're testing every type of antiviral treatment that's already out there to see if there's anything that's going to be effective against this. And they're doing a really good study right now, and actually a controlled study, to see if IV vitamin C works for people who have that severe lung disease, that ARDS. But we've known with previous things like SARS, which is also in the coronavirus family. When people were getting really sick with SARS, IV vitamin C was helping their lungs recover faster and get them out of the ICU. So we're working on all kinds of stuff, but it doesn't mean like grab everything in sight.
So I do have a question. I was reading something about the pneumonia vaccine that's out there for different age groups. Mo has a respiratory issue, so I'm wondering if he should go and get that. It wouldn't obviously combat this virus, but it could help him with some of the respiratory issues that are out there. I mean, they have different age groups, so I'm not sure what to do to tell him, but I'm about ready to send him to the doctor to get it.
Yeah. So assuming the doctor's office should have a separate area for sick people and well people to get that in terms of any vaccines. But yeah, you want to be protected against anything that you can be, even though, like you said, it won't protect against this in particular. But the last thing we want to do is get any type of illness right now.
Yeah. I would second that too. We do, most of the pharmacies are doing probably the majority of vaccines at this point. And just, they're able to, I just touched my face, go figure. But they're the ones that are, we're the ones picking up most of the vaccines at this point, just by volume. And that's the same thing I would reiterate as well, is that it's not going to help right now with this one, but obviously after this is done, then definitely get in. There are 2 different pneumonia vaccines. Obviously, one gives a little bit more coverage, but it is ideal to get both. Most of them are for immunosuppressed patients or elderly patients. There's kind of a timeline that you get those. But if you're also just high risk in other, healthcare professional or something else where you're possibly going to be in touch with that. So, but just kind of check up on all of your immunizations and definitely get the flu shot every year, if at all possible, as early as you can, so that it also creates herd immunity, which is a real thing. People think that was kind of a joke, but that's a real thing.
I teach my students
matters.
every year about herd immunity, every year. And what I'm hoping is it teaches people that they really need to get their vaccinations. I mean, again, I know that we don't have a vaccination for this, but it's so important. I was very transparent with my students. We had a very long discussion about flattening the curve. And I told them, I said, this is how a viral works. And you're probably going to get sick and it's going to be okay. And, but I said, it's really important to get your vaccinations. I did this all last week with my students. And I said, don't panic. It's going to be okay.
Yeah, I was going to actually throw that question out there about how should we talk to our kids about this? And that was going to be something I posed to the group, but this seems like as good a time to any. And then we'll come to a question I see Lucas had here in a minute. But I'd love to know from Jamie or even you, Jen, because you're working with kids every day. What's the best way to talk to our kids about this?
Well, I had high schoolers, so I was very honest with them. I found that with my students, I'm very transparent. I've always been transparent with them. I tell them what I'm doing and why I'm doing it, and I get greater buy-in. And so with the high school kids, with the older kids, they get it, they understand, it put them at ease, and, it was fine. I saw a really cute cartoon on Facebook, although I've kind of banned Facebook today. It was making me upset. But I did see a really cute cartoon on Facebook about the coronavirus for kids. I don't know where it is, but it was really cute. It showed this little virus trying to get in, and it kind of showed them that everything was going to be okay. So, I have the bigger kids, so I don't know how to go about it with the littler ones, but I thought that was a cute cartoon. It's somewhere out there. I'm sure that you can probably find it. But I'm always been a teacher that's been very transparent with my students. I'm very honest, and they buy in. I'm like, even one of my students said that to me once. She said, so if you just, just go with it, it's going to be stressful. It's going to be okay. And you're going to be okay. And, and they understood it. It was a nice lesson too. That takes care of your science lesson for the day.
Yeah, I agree. I have younger kids and a lot of friends with the younger kids. And I mean, transparency is the key. If they have access to any other people or the internet at all, they're hearing stuff already. And sometimes they might have a fear in their head that we don't know they have that is a little more catastrophic. Like they heard from some kid at school, can coronavirus infect your dog or give you cancer or make your head turn green? There's all kinds of my daughter laughing. There's all kinds of fake news out there too. And so you don't know what your kids are worried about until you ask. They might be worried that, mommy and daddy are going to get sick or something like that. So we talk about it. We talk about how we take care of ourselves. We've been really focusing on our health pillars together, and it's been fun. And then there's another Facebook video that is a mom put some like pepper in the thing and showed her kids how to wash their hands. I'll find that and share it with the group. It's a really good video, and it helps kids see, because you can't see germs obviously, but it's really helpful so kids can understand why it's important to wash their hands. And the more we get them involved in this instead of ignoring it and not talking about it in front of them, the less fearful they're going to be.
Yeah, that's great. And also, Matt and Braden, I think Matt's on the call. They're going to be doing a call that's for our kids, for, you know, JDLs or NGLs, junior dream leaders or next gen leaders. That's what we call our kids and our teens within FamBundance. So Matt, could you just give us, you know, what are you guys going to be covering on that call, and when is it, and how does somebody get the info for that call? If they
Yeah,
want?
absolutely. So I'm going to be sending out an email later today with the information and the links and everything. But right now we have the call planned for 3 p.m. Eastern time on Friday. I think that there's enough kids that are out of school that the daytime call should be okay. And we'll get, yes, Missy, I will get that out to you. So 3 p.m. Eastern on Friday, 12 o'clock Pacific. We're going to be talking to the kids about, you know, how to stay calm during a big panic like this, where to look for real information versus just, you know, dispelling the rumors that you hear, things that they need to do to be safe as kids, and some other topics too. So, you know, like I said, we'll be emailing that out to everybody in all of our communities. Hopefully by the end of the day today, we'll get that in.
And there's probably people who are going to find their way to these calls who are not actual members yet of, or going to be, of FamBundance and GoBundance. Because one of the things we've decided as an organization is to, as I stated earlier, just invite everybody to participate in this right now, to support as many families as we can. So we will update the next call. Let's get that on that website, Matt, the one where we have FamBundance.com/coronavirus. We'll just keep putting whatever our next calls are up there on that website. That way, anybody who wants to participate can be welcome to that information.
Yeah, and obviously that on that call, any parents that wish to be, you know, present and be on that call with their kids are all welcome. But it will be a call focused on the kids.
Yeah.
So.
Absolutely.
And one really important thing to remember, unlike some of the other viruses, like the flu and stuff like that, which does tend to be very hard on kids, this virus in particular is not seeming to be killing kids. They're getting much milder cases of it. As far as I know, the latest statistic is there have been only 2 deaths under 18 worldwide. So that's just that little reassurance for the kids, you know, that just something else that can kind of help bolster them.
Yeah, that's a good fact to know, and it's not only reassuring for the kids, but for us parents too.
Yeah,
I find that really interesting. Like, it really, as a scientist, I'm like, what is it? Like, I want to know, like, what is it that's not in their bodies that's in ours that this thing is attaching to? Because I know how viruses work and I know what they look for. So what are they missing? What is it?
Or what do they have more of?
Exactly. And you know what's funny? When I go to the store, when I go and get stuff, like, I'm stocking up on all the healthy stuff. All the healthy stuff is there. The vitamin C, everything. So I have like tons of oranges, vegetables, fruits, and it just boggles my mind that people are going for certain things. But I really want to know, what is it that's in the kids or not in the kids that this thing can't really affect? That's the thing. And I hope they kind of figure it out.
It's such a lung component. Like the flu can, sometimes there's a little bit of a diarrhea component. This is such a lung component. I suspect it's going to be the level of, you know, surfactant in the lungs, the level of antioxidants, their compliance is better. So I think it's a combination of those issues. As far as I know, most kids aren't smokers and haven't been. I mean, I hope not. That one kid that's on the video. Yeah. Oh God, hopefully this will get all these idiots to stop vaping.
Yeah.
So it's going to be that combination of things, because their lungs haven't taken the hits of damage. You know, we've had a lifetime of, 40 years of being exposed to pollutants, 60 years of being exposed, and ideally they're younger, cleaner, and their lungs are just better.
Yeah.
I'm guessing surfactant is the issue. It'll be interesting to find out.
Yeah, it keeps the alveoli moist and open.
Do you recommend getting on steroids if you have asthma or use a nebulizer, albuterol, to kind of strengthen the system?
So that's an interesting question. And my answer to that would definitely be no. Because what steroids do is they suppress your immune system to calm that down. So unless you need to be on steroids if you're having a severe asthma attack, I would not. And again, the nebulizer, if you're not wheezing or having any symptoms, isn't going to do anything to bolster you. If you need it, if you feel the wheezing and the other symptoms, by all means, it's extremely important to use it. But as a preventative, it's not going to do much.
Okay.
Now, staying in moist air so your lung tissue doesn't dry out is going to be key, having a humidifier and stuff like that.
Yeah, we have that coming on Wednesday, tomorrow.
God bless Amazon, right?
And also, I mean, I'm a big fan of the saline spray. Zach's pediatrician a long time ago recommended it. Anytime he had a stuffy nose, we use it every winter. I spray it up his nose every day, 5 times a day. And I will tell you, I swear by it. So we have saline spray all over this house, in addition to the humidifiers that are coming. So we're just like combating it anyway. There's something to be said about salt water.
Hey, we had another question here I wanted to go back to from Lucas. And I know we don't want to stock up on too much stuff because that stresses the supply chain. I heard that earlier, but he is saying, is there anything that, you know, he said a friend of his recommended getting a script of Singular just in case, and I don't know what that drug is. And I do get it so I don't have to go into the hospital. So I guess, is there any medicines we should be getting, maybe not stocking up on, but just getting and being ahead of in case we are secluded for, 8 weeks or more?
I'm not sure that any type of antihistamine and allergy type medications are going to have an effect on this if you do get the virus. And so you want to keep bolstering your system. There are some reports coming out now that they think avoiding ibuprofen during this, we're waiting for the science behind that, but because it's an anti-inflammatory, so it blocks your body's inflammatory cascade. We're waiting to for the full science on that. So really the best things that you can do is have the healthiest body possible. There's no medication that's going to stop this or prevent this or bypass it. But heaven forbid one of the rumors gets out there that, Singular will cure this and everyone's going to be stomping to the pharmacy. I wish there was something I could tell everybody right now, please go get this. But this right now is nourishing food, energizing exercise, restorative sleep, stress release, and meaningful connection.
Yeah. And I think we have to, I did a meditation just an hour or so right before this call because, candidly, I was feeling a little bit stressed. There's been a lot of changes, a lot going on for us all. And I think, the thing that came to me in that moment was that we all have to take sort of a collective deep breath and just remember that it's going to be okay. It's going to pass. And I think, not allowing the stress part to get to us is probably one of the keys to staying healthy. And I know, Jamie, you talk a lot about how stress is a big killer. So what would be, other than meditation or even some tips around meditation, but what are some other things we could be doing right now? Breathing deep. What else can we do though to relieve stress right now?
So there's a really fun list, and I think everybody should have multiple things in their pocket for stress relief. So first I invite people to decide whether they want to stress hard or stress soft. Now, what does that mean? So doing something quiet like a meditation, petting your pets and stuff, that's that soft, quiet kind of stress. But if you're so keyed up and have all this nervous energy, sometimes it's really hard to do those, and trying to sit and meditate when you're feeling so anxious can make you feel worse. So what you can do is what I call stress hard. So there's other types of stress release you can do. Go outside and go for a run, pound a punching bag, stuff like that to let it out. We don't have to pretend that this isn't stressful. And so we can manage our stress in any way that feels good. For me, when I'm super stressed, that's exercise, also hugs, and so it's not just one thing, it's that combination of things. And human beings, I know I'm laughing about that. I saw that comment, the baby boom is coming. I'm just saying, it's a good form of stress.
Social distance.
Now with the people you live with, by all means. Yeah, the
Well,
baby boom is
mine,
gonna be
yes,
hilarious.
but-
Yeah, and so finding just tons of different ways to release it, let it out, and talk to it, and particularly in the family structure. It's going to happen, you know, one day one person might be more stressed than the other person. So we need to not say, oh, calm down, don't worry. That's got to be one of the most annoying things that people do. It's just like when someone's feeling stressed, just say, how can I support you? How can I help you through this? Do you need to talk it out? Do you want to cry? Do you want to go be alone and take a shower or go for a run or something like that? Yes, for the people who jumped on earlier, it is okay to go outside. The outdoors is not the bad thing. It's the people congregating together. So go for a run.
It is not closed, people. It is
Yes.
still open.
Yes, it turns out that trees don't contaminate it. Yes, honey?
Which one is the one? Which one is that?
So if you have the Peloton, they have a bunch of apps or like classes there, and I just started doing the meditating apps, and I found that was really good. And I apparently for right now, one of my running buddies in my running group said that they are offering 90 days of free trial for the Peloton app on your phone. And they have a bunch of classes, and they actually have an outdoor class too. So there's all these different things that you can do. You don't need to have the Peloton to do it. So you can do outdoor runs, you can do outdoor walks. It could, send you, it could take you like, walk for 5 minutes at this pace and then kind of slow it up. But the meditation, they have yoga. I think that would, and stretching as well. So those might be really good to use with the kids. And I mean, for 90 days, if you don't have it and you don't have the Peloton, you're not obligated for anything and you get it for free. So I think they did that to help out with this situation.
Yeah.
And I think I really love seeing how companies are just doing the right thing, helping people out. There's something too with the connectivity, like we're not meant to be isolated beings, and that group connection is such an important part of social interaction. And there's a lot of neuroscience behind if you're doing something with somebody in tandem, walking the same way, singing a song together, dancing at a concert together, that helps us feel that extra level of neurochemical connection. You get the oxytocin and stuff like that. But there's other ways we can connect. On Peloton, you can do a group class with a bunch of people from around the world, and it just makes you feel not so lonely. And we're doing these calls, the GoBundance Women's Group. Our conference was this week in Austin and took the whole thing virtual and have been doing such deep, meaningful connection. It sucks that I've had to miss some of it because I've been busy dealing with this whole issue. But there are so many ways to stay connected that are safe. And I just think that's such an important part of the stress release.
And there's a great TED Ed talk too, not TED Ed, it's a TED talk. I forget her name. I showed it to my students when we were doing the endocrine system about how to make stress your friend. And there's that huge connection with oxytocin as well. Like it's a stress hormone, and how that social connection really helps deal with the stress and reach out to other people and make that connection. It's like a 14-minute TED talk. It's amazing.
Yeah, when I'm teaching my stress release classes, I tell people how to turn your stress into your superpower. Because if you think about it, what's the fight or flight response? Your heartbeat quickens, you get more blood flow to your muscles, your eyes dilate to take in more light so you can see what's going on. You can't feel as much pain. You're very focused on things. So it's kind of like having superpowers. So all of a sudden your vision is better, you're stronger, you've got more blood flow. Use that to your advantage. That's what I talk about when I tell people stress hard. When you're feeling that, instead of it's scaring you and going against you, use it. I mean, go clean out your garage with all that extra energy. We're going to have like the cleanest houses ever. I'm taking my kids outside now.
I had another quick question, I guess maybe just to look at it from a contrarian standpoint, but with everyone having all this family time, which is something we should be very thankful for and blessed for, most people are not used to that. So how do you deal with the stress that comes with being cooped up and around your family so much when you're not necessarily used to it? I could see some people having that issue. What do you guys think?
Yeah, when everyone starts driving each other nuts. So
exactly.
I think having structure in the day helps, so people kind of know what to expect. What is everybody doing? Okay, mommy has a meeting at 12:30, so you're going to eat lunch and do outdoor recess and try not to interrupt more than 500 times. and allowing that time for play and all of those type of things. And then everybody's going to need space. You know, everybody go have some alone time with reading, have some together time, but start playing board games, start doing stuff that has that level of connectivity. And I think a lot of people are going to find like, yeah, I really like these people I live with. They're pretty cool. And then when you need a break, take a break.
I want to add to that. If you check out that the fambundance.com/coronavirus page, some of the activities we have on there are things that will help with that being cooped up together. Definitely make sure you're checking out our conflict resolution guide. This is, you know, it's going to be stressful when there's a lot of people, and the method that we put out for resolving conflicts could be very, very helpful, especially, you know, when nobody can leave, essentially. So we've got some resources up there. If we have more that we can put up as we develop them, we'll put them up there as well.
Yeah, and I mean, I've seen their conflict resolution. I've seen it in action, because you can imagine when we do these events and we have 40 kids all together, there's a couple of conflicts every once in a while. And I just watched them use this method, both Braden and Matt, to really bring understanding and move, you know, kids through their emotions and create connection. And so it does really work. And I think, you know, the other thing to be thinking about is, you know, establishing your values as a family, if you haven't yet. That can really be a beacon of guidance for you right now. Like if you're really coming up with them right now, think of how powerful they will be, because you're really having to come together now. So and if you've already structured family values, like going over them as a family, what are they and how do we live them now during this time when things are changing? Because really we should be holding on to our values tighter than anything else right now. That should be the bedrock of your family and your foundation. So whether they're defined or undefined, bringing them into discussion of what you value right now. And we have our full, you know, workbook available for you on the website as well. But, you know, you can certainly just sit down and talk about what you value. That's something that could be important. And also think about how you bring the best of the past, the present, and the future into your discussion. So how can you appreciate all of the amazing moments that you've had as a family? Go back and relive them together. Discuss your favorite moments as a family. And then think about, too, what can you appreciate about the present moment, you know, and what's unfolding for your family currently? How have you been supporting each other? Where have you seen each other lifting each other up and living your values? And then also my favorite is the future. At some point this will pass and there'll be vacations and adventures and things to go on. So why not plan a bunch of those now? You don't have to set dates, but what are going to be your next family adventures? And could you not come up with your 2021 sort of adventure plan or your 2022 adventure plan, or both? But I think giving each other some creative things to focus on that bring out the appreciation that you have of both the past, the present, and the future as it's unfolding and emerging. I think those are really things that not only do I want to be doing right now, and this is me kind of talking to myself a little bit, but I want to dive back into all that stuff too. And this is the perfect opportunity to do that.
So it's funny that you mentioned the
powerful.
travel. It's funny that you mentioned the travel thing, because I have a friend in the travel industry who just mentioned today she's having her kids plan travel adventures, like be the travel advisor and research the areas and what they want to do. So that can take a whole day of stuff. And I was like, oh, that'd be great. Like I'm trying to pick themes for Zach. I haven't really gotten him on a schedule yet. I'm kind of just letting him be for this week. It's kind of nice to just take a break and a pause. But the other thing as a teacher, like my students really struggle with resiliency. And so for them, you know, being able to figure out and be creative, like how are we going to solve this problem? How are we going to be resilient? You know, my grandparents, they grew up in the Depression, and my grandfather can do anything out of anything. He's got like crazy MacGyver skills. So this is their chance to make those MacGyver skills and be resilient and really, you know, show that they can't, because I mean, honestly, I've been struggling with that. They just want to give up so quickly. And here is a chance where they can really, you know, zoom in on those skills and really try to, you know, figure out a problem. If they don't have this because we can't get to the store, so what do we have around the house that we can use? Be creative.
That's so important. And it's to not just hand them the answer. Even with my younger kids, when something happens, I'm like, use your problem solving skills. And sometimes they try a few things I might not have tried or I already know aren't going to work. But letting them struggle through that is really important. This pandemic is such an opportunity for us as adults to model how we can deal with stressful times. So we're literally teaching them in real time, because whether the pandemic happens ever again or not, we're all going to have a lot of different stressors in our life. And so this is such an opportunity for us to teach our kids. I heard a saying a long time ago that said, be careful what you say to your kids, because your words become their inner voice. And instead of taking that as a warning, I take that as an opportunity. So we use a lot of mantra, use your problem solving skills. Inner voice of resilience from seeing this happen, that's going to help them with adulthood. There are good things that are coming out of this. Also, sorry, my kids are being super loud in their TVs right now.
Looks fun. You know, I was on a call, actually saw the beginning of the women's tribe call, and they started off with moments of resiliency and just connecting on when in the past have we already been resilient, and thinking about all the times that we went through different challenges and how those ultimately helped shape who we are. And it reminded me that I saw a meme yesterday. I think it said something like, our parents were called to war and we're being called to stay home and sit on the couch. And I thought that was, and obviously Jamie Hope is now calling us out into nature to play too. So thank you for the there. But
yeah, get off the couch and exercise. Just don't go to the gym.
Exactly. The difference though, in what we're being asked to do, and also our kids, like, this does build a little bit of resiliency. And I think that's great. And the other thing that I saw yesterday when Gary Keller addressed all of Keller Williams, he said something along the lines of, our darkest hours have the chance to reveal some of our finest moments. And I thought that was so appropriate that, whether I don't want these to be our darkest moments, and I don't think they are, but just knowing that in those moments of challenge, like, we can reveal our true character and we can show who we really are, not only to our children, to your point, Jamie, but also for ourselves. So we can really be a force for good during this time right now. All right, let's see if we have any other questions here. Jeff Harrison's got a baby here, him and Ash May 8th. So I would definitely Google it before May 8th, just in case.
What did they always do in the old movies, like boil some water and rip up some sheets?
Yeah, you definitely
I have no idea what that's supposed to be used for.
Definitely need towels. I know that. I've watched enough TV to know that.
Yeah. But this is also a rise of a change for society. We're realizing that, telemedicine is possible. We're all realizing how many meetings could have just been an email. I mean, there are some positive things coming out of this. There are so many companies, London's, like, Tucker Max's company, Scribe, that are just giving away content. Like, here it is. And so it is so cool to see all those things coming together. I think this is going to be this is a bad thing. There will be a good shift from that, though.
I think we'll realize how much we want human connection. And I think, we'll also realize what's actually important and what was unnecessary in a lot of ways. So I think it could be healthy. We have some time for another question or two or comments.
I actually have a question that it didn't come up yet, Jamie. What a lot of people in this community travel frequently, and some of us have not been able to slow that down, depending on where their job lies. For those that do have to travel, what should be done during the travel and also post travel to help keep ourselves and the world at large safe, and our families?
So that's a really important question too. So if you're in your own car, that's different. But if you're talking public transportation, like airplanes and stuff like that, that's going to be really key. First of all, if you show any signs of illness, don't get on a plane, please, for everybody's sake. So that's the first thing I would say to anybody who is traveling. Please, please, please don't do it if you're sick. If you're not sick and you're choosing to travel, you can wipe down your seat. You can choose to wear a mask, you know, all those different things, and maintaining your health. Up until my hospital grounded me, but I would have grounded myself too, because I've already been exposed about a billion times. As a former person who traveled a lot, you're going to different time zones and a bunch of different activities. You got to still make sure that you are getting tons of sleep, getting the exercise, eating healthy, all of those things, so you can maintain your health for when this comes. Because I know some of us on the road wear ourselves down a little bit.
Awesome.
And it's a GoPro that has airline tray cover. That's awesome. And it's really challenging us to see how many things we can do virtual. It was kind of this hilarious little bit of accidental thinking. My boss called all of us, wanted every doctor in our entire department to come in together for a meeting so we could talk about coronavirus, and all the rest of us are like, that's a terrible idea. Let's not infect us all at once. And they realized that there's such thing as Zoom. And so we're actually doing things like the GoBundance Women's Conference and stuff virtual, and it's still having an amazing, great effect. So be proactive. There's business opportunities here in helping people learn how to do that, or just give away the content for free. But you'll be surprised that even those things you think you can't have a meaningful connection in over the phone, you can still do it. And it's really cool. So.
Thank you, Jamie. Awesome comments. And thank you guys for all that great questions and interactions. What else? Who has some other questions or comments? So Jamie, do you recommend if we run out of the healthier food that is going to the grocery store, and if we do have to go out in public, should we be wearing masks? And if we don't have masks, should we wear bandanas? I mean, that could be scary especially if you're going to the bank, but.
No, you know what, if you come in a bandana, they'll be like, oh, thank God, he's just here to rob the place, not get us all sick. There's gonna be relief. There's a problem that we have the recommendations are changing constantly. Literally twice yesterday, our hospital changed its policies about what kind of protective gear we're supposed to be wearing directly in the face of that. So we're all gonna have to get groceries. It's a thing. Any type of drive-up services, anything that you can get shipped to your home are great. Fortunately, this community is very blessed to have the resources to purchase those kind of services. Wiping down the surface of the cart. And people, I'm kind of isolating myself personally from going to the grocery store because I know I've been exposed so much. But we all are going to need food. If this lasts for 8 weeks, I don't know about you guys, but I only have 8 weeks of food in my house. My kids want to eat every day. Getting out of control. So be safe, use precautions, clean stuff, wash your hands. If you've got masks, great. It's hard to get them now. And people are looting hospitals. It's outrageous. Don't get me started on the rant of that, but we need that stuff. One's being exposed.
Hey, Jamie, I have a question about asthma. Should people with asthma or allergies be any more concerned than a normal person with this?
Yes. Unfortunately, people who have any type of lung disease are at higher risk. So they should practice substantial avoidance if at all possible. And the more severe the lung disease, emphysema, COPD, and those type of things are a bit more of a risk.
Okay, thank you.
Mm-hmm. And then any type of asthma attacks or anything like that happen, just treat them as normal.
Hey, Jamie, one other question. What's the biggest symptoms that you guys are seeing? What is the first thing that people are kind of saying, oh man, I feel this?
So they get the respiratory stuff pretty quickly, the shortness of breath and the cough when you start developing symptoms. It's a 2 to 14 day incubation period from the time you're exposed. And that just kind of varies depending on the person. But then everybody, as soon as they get symptomatic, it's very obvious that it's a respiratory thing. They're getting that cough. It's not the substantially high fevers that we tend to see more of with influenza, where people are 103, 104, but still fever, that awful fatigue, and just, it's when you take a deep breath, it's uncomfortable. You feel like you're not quite getting enough.
I heard a lot of people are having, they're carrying it and don't have symptoms. Have you seen those people? I mean, is there anything that, I don't know, maybe I could see the person and say, oh yeah, that guy definitely has something going on, or
Yeah, if somebody looks sick, definitely run away. We don't know the rates of asymptomatic carriage right now because we don't have enough. We're not testing asymptomatic people. We don't have enough tests. So we don't, and it's just, are they asymptomatic now? But, you know, give them 10 more days and it's coming.
Okay. Thanks.
Yeah, we're ramping up tests quickly. At first, we had to call the health department to get permission for every single person, and they kept telling us no. So our hospital kind of gave them the middle finger and went to a private vendor. So now we can test as many people as we need to because we need to know how this is spreading. But that drive-up testing is a really important component. And I mean, any other hospitals that you know, if you know anyone at hospital, I mean, we'll just share our model, free open access. We want everybody to be doing this to help keep us as safe as possible and keep people out of the hospital if they don't have to be there. Like, for example, people do need to go to the hospital to deliver babies. So if the hospital is full of a bunch of sick people, you know, there's risks.
What is being done to treat people? Like aside from the people just staying at home, the ones that go to the hospital, how are they being quote unquote treated?
So we're trying various types of antiviral treatments, and none of them are proving to be substantially effective. We are putting people on life support, on ventilators to help protect their lungs and breathe for them as this passes. And there's some really good studies showing that IV vitamin C has some efficacy, particularly when the lungs fill with fluid and get that bad. And they found a lot of that data from when the SARS epidemic was coming through, and because the SARS is also in the coronavirus family. So we're throwing the kitchen sink at this. If someone's sick, we're doing absolutely everything we can until we run out of ICU beds and run out of ventilators. We'll
so it sounds like
as many as we can.
You're just keeping them in breathing mode at this juncture, and that's all, right? Just letting them cure themselves. So long as they can breathe, it'll run its course, hopefully.
Yep.
Okay. Is there anything else people can do? Like
actually reverse the course of disease. Sorry, go ahead.
Yeah, is there anything people can do with regards to vitamin C, like get an IV bag of vitamin C, that sort of thing?
At home? No.
No.
But there are places that do that. We don't know if it has any effect at prevention. So.
What about people? And I know Mo's on the call too, and Mo has asthma as well as I do. Like, is there anything people with that could do differently, or is it all pretty much the same?
Not much. Treat the attack. Treat any asthma attack if it comes on. But anyone with any type of lung disease, just aggressive prevention.
Do you have a humidifier, cool mist humidifier?
No. No, I don't have a humidifier.
Yeah.
Yeah, you don't want your passages to get dry, so that's really important.
Yeah.
Yeah, that's good to know. Okay.
Yeah, and Amazon is still delivering, and we just got the Vicks one. My son has had it forever since he's been a baby, and I ordered one for Mo and myself.
What's it called? A Vicks humidifier?
It's the Vicks Cool Mist humidifier. It's filterless, so you don't have to worry about changing a filter. You clean it once a week. I use vinegar and water to clean it, and it's awesome. I mean, it's I would get one for anybody in your house. They're like $40.
And you sleep with that?
Yep, at night.
Okay. All right.
Yep.
My wife says we have one. Okay.
Okay. But you might want to get another one just in case if both people were to get it, just to keep your lungs going.
Okay.
Why does keeping your lungs with more moisture do anything? What does that do? Why does that help?
Well, I mean, I can answer some of this. There's alveoli in your lungs that are there for gas exchange, and there's a surfactant that's on top of it, and it helps to keep those alveoli open. The alveoli are like little grapes. Basically, it's like a bunch of grapes at the end of your lung tubes, and so they get down there and it keeps them open. And when they start to stick to one another, that reduces the surface area for gas exchange, including carbon dioxide coming back from your cells as well. That's a waste product. You don't want that in your body because that will make your blood really acidic. So you want to get that out, and you want to get more oxygen in. So if you have those open and you have them moist, those sacs won't go in on each other. And so
even without disease going on, it'd probably be a good idea to have one then, right?
We run it all winter long in my son's room, no matter what.
So your mucous membranes are a barrier of entry to your body because each of them are around a hole. And so in order for that barrier to act in the best way possible for all the germ fighting cells and all those things there, they need moisture to live. So as those nasal passages and stuff get really dry, you're actually damaging the cells that help prevent the infection from taking hold and getting in. So it's that part is really important. If you're in a place that's warm and humid already, that could be enough. You don't have to turn your room into a tropical rainforest. It's about I know, right? Everyone's walls are gonna get moldy and they're gonna be all pissed off. It's about preventing the dryness. That's the key, because the mucous membrane is the barrier. And that's why, as we've all learned, as I said earlier, we all keep touching our hand, touching our face and our mouth. So we're taking something and putting it right into that area and really just challenging that barrier.
Yeah, we don't use that humidifier in the summer. It's only as soon as it starts to get dry, we pull it out, and it's on every single night. But you have to clean it. Vinegar and water is good. We do it once a week.
Yeah, Jeff's made a couple of good points. Definitely drinking water, and then also staying away from people who are immunosuppressed. There's a lot of people that start going through nursing homes and dialysis centers. That's gonna be hard.
Yeah, Jeff, thanks for your perspectives as well. That was very helpful, and thank you everybody for participating. I don't want to keep you too much longer, Jamie. I know you're probably in between a bunch of different things, so thank you so much. I'd love to just take a moment, if anyone can just appreciate Jamie, if anyone has anything that they want to say that they learned, that they appreciate. I mean, I would just say thank you for your time. I know that you're busy and you could have been called to do many things right now, so thanks. And I just appreciate also how you are so playful with your kids and outside and just modeling all the things we need to be doing while we're on the call. So thank you.
Thanks.
Yes, thank
while
you
we
very
were on
much,
the call,
Jamie.
my
This
daughter
has
ate
been
broccoli
great.
and exercising. Thank you. You guys are my family, and staying connected. This is really important to me because nobody wants to come visit me right now. I've lost both babysitters and a dog walker, so it's lonely. So being on the front line, staying connected to you guys is actually therapeutic for me too. So thank you.
Did both your babysitters and your dog walker just say, I'm not coming to work, or?
Well, my one babysitter, her husband has very severe heart disease, and her father-in-law lives with her, and he's old and very sick. So I called her and offered. I said, I understand if you don't want to come over, because we're going to get out. I'm in the front lines. People are spraying us in the face. And she was very relieved. And the one dog walker also lives with somebody who's sick. And then my other one called me today with a fever and a cough. So.
Oh boy. Okay.
It's also nice to have somebody to talk to on the front lines, because we're not getting a whole lot of communication about what we're supposed to do if we do get it. And I wish that that's one of the things that I've kind of said, I just want to know what to do when I get it. And we don't know because we're not being told. And then, again, transparency is the key. So thank you.
Yeah, that was awesome.
Thanks, guys. We appreciate it.
Thanks, everybody.
Yeah, thanks, guys. Hey, everybody, stay safe. Love your families. Use this time to create meaningful connections, to think about the future, to appreciate the past. Just really cherish the time we have. Take deep breaths, drink lots of water, and get a humidifier. It sounds like that would be good in a dry area. All right, guys. Thank you.
Take care.
Thanks, guys.
Thanks, Mike.